Hey Ken, thanks for attending my seminar the other day. Here's my business card. My name is Marcos. I'm an independent agent. And I know you had a couple questions about enrolling into the United Healthcare Dual Complete Plan. I just want to go over some details with you.
Great, I appreciate it.
Great, so first we get started right here. Just want to go over some of the information with you. Just so you know, this is all approved through Medicare. So everything I say is not really what I feel or what I think, but it's already been approved through Medicare. So I'm going to go over some of the details of what this plan entails. So first and foremost, this is a zero premium plan, which means between your Medicare and Medicaid, this does not cost you anything at all. Okay? You're also going to have these additional benefits. Everything right here and on this side, which is your medical benefits and your prescription drug plans, that's already being covered through what you have right now. So it's nothing different. I just want to emphasize the fact that you're not going to lose any benefits. You're going from a Medicare to a Medicare Advantage plan, which means there's got to be some advantage in order for you to enroll into this type of a plan. And we're going to go over that in just a second. So just to start off from the top, your doctor's visits are zero copay, as well as your primary care physicians and specialist visits as well. Because this is an HMO, your primary care is going to have to issue out a referral, and so you do need one prior to seeing your specialist. Anytime you have any type of preventative services, those are a zero copay. Those are things that you would have, like your physicals once a year, anything that you have that's preventative wise, that's all 100% covered for by us. Inpatient hospital care, in case you do go to the hospital, is at zero copay. You don't pay anything for that. Skilled nursing facilities, so something that if you have to go to physical therapy after a surgery or a hospital stay, we will actually pay for you to go there and do your physical therapy. Outpatient surgeries is going to be zero copay as well. That means you're in and out of the hospital, usually the same day. Sometimes it's at the doctor's office or a standalone facility. This is going to be covered for anything like colonoscopies, cataract surgeries, very quick procedures that don't require an overnight stay. But if you do need to stay overnight, again, like I said, we are going to pay for that. Here's for all your diabetic monitoring supplies, which are your test strips, your lancets, your machines, all that. That's actually going to be covered for as zero copay as well. And home health care. Home health care is in case you can't perform anything such as ADLs or activities of daily living, which means cooking, cleaning, bathing, anything like that. We'll actually pay for somebody to come by and help out with that. All your diagnostic radiological services, such as your MRIs and CAT scans, those are all paid for at zero copay. Your blood work is at zero. Your outpatient x-rays are at zero, so just your normal x-rays. We got your big x-rays covered for and your MRIs, and we got your basic x-rays covered for. Those are all at zero copay. Now, here's a good one right here, is in case you ever do have to call 911 and use the ambulance, don't worry about it. Don't worry about the cost. We're actually going to pay for that cost. So if you are in an emergency and you do need to pick up the phone, dial 911, because we will pay for it. Emergency care and urgent care, if you do need to go into the emergency room or even to a local urgent care or minute clinic, as long as they're contracted with the facility, as long as they're contracted with the insurance plan, we will take care of that. So these are all your medical bills that are actually covered underneath your A and B portion of your red, white, and blue card. This is everything that they are already doing. I just want to emphasize the fact that you're not losing any benefits. We're only going to add on to those. And it also goes over here with this side with your prescription drugs. There's no deductible involved with this plan at all. And you could pay anywhere from $0 to $1.20, sometimes $3.30, depending on the prescription. Typically, your prescription cost will stay the same because you do have a subsidy that'll actually offset that cost. All other prescriptions, which means your brand name drugs, are anywhere between $0, $3.70, and $8.25. Typically, you'll pay anywhere between $1.20 to $3.70 for the majority of your prescriptions. So those are benefits that are continuing to stay the same. Like I mentioned, these are all covered by A and B and on your prescription drug of original Medicare. The point of me being here is to help you and educate you on your options and know that this plan in particular is a Medicare Advantage plan and it is an HMO, so there is a network of doctors like we already talked about, but we will have those covered for. There's got to be some type of advantage to joining this type of a plan. And what this plan is going to offer you is right here, and that's what I'm going to go over right now. First and foremost, we're going to go through and we're going to cover your eye exams. You have one routine eye exam every single year. So, Ken, when was the last time that you actually visited the eye doctor?
It's been a while now.
It usually is. Most time people will actually just go through, and if they don't have the time or the money to go and go to the eye doctor, then they'll usually buy a prescription, non-prescription glasses at the pharmacy, or Walmart or CVS or even the dollar store. That's not the right pair of glasses that you need. So what we're going to do is we're actually pay for you to go, get your eye exam. Once the doctor gives you your prescription, we're going to pay up to $150 every 2 years for a pair of glasses.
Great.
So that's what we're going to help for with your eyes. We want you to stay nice and healthy. Remember, that's every single year when we want you to get your eye exam done. Along with that, some of the additional benefits that we offer in this particular plan are dental services. What about your teeth? When's the last time you've seen a dentist?
I wait too long.
Most of us do, because we all know that the dentist costs a couple $1,000s sometimes. But what we want you to do is we want to start on the preventative side. So what we're going to do is we're going to pay for you to go through and have all of your x-rays, cleanings, and exams done once every 6 months at no additional cost to you. So once you get in, keep everything going healthy, just like your vision. We want to pay for all those exams so you can stay healthy. And if anything happens to where the doctor actually needs to do something, or excuse me, the dentist needs to do a filling, an extraction, maybe even dentures, because sometimes when people have dentures and they haven't done it for a few years, their their gums actually start to shrink because of the grinding of the dentures. So we pay for all those benefits. Don't worry about it. Anything that the dentist needs, we pay up to $2,500.
Right.
So we'll use that. I want you to use it before the end of the year, or else it does expire. So along with the vision and dental services, anything above and beyond that amount is what you'll pay for. So if you actually get a pair of glasses that you want, that you really like, for $200, you just pay the difference of what the plan pays and what the cost of it actually is. So this should be, if you can find it with underneath those limits, are $0 out of pocket for you. Another thing we have is we offer podiatry care or foot care. You can actually go 4 times a year and we'll actually pay. A lot of individuals who have diabetes or any other type of blood circulation issues, the doctors encourage that you go to a podiatrist so you can actually have kind of like a pedicure. They want you to go and do that because you can lose circulation and feeling in your feet as a diabetic, primarily as a diabetic, and what happens is you could stub your toe, you can cut your toe, anything like that, and not even know that you're bleeding because you lose all sensation. That can be very dangerous, so we actually pay for you to have those services taken care of. Your hearing exam, we actually pay for you to go once a year as well, just like your vision and dental. As you see, there's a pattern here. We want you to go once a year to stay healthy with all this stuff, and if you do need anything, we pay up to $1,500 every 2 years for hearing aids, and that does cover over the ear or in the ear type of hearing aids. Transportation services. If you do need to get to any of these services and you personally can't make it there through driving, or a family member or someone can't come and get you, we actually will pay up to 24 one-way trips per year, which is 12 round trips. So if you need to go to and from, we'll pay 12 different trips, round trips per year at zero copay to you, so it doesn't cost you anything at all. We want you to use these benefits, but we're also going to provide an actual method of you to get to these facilities and utilize the benefits. Chiropractic care is also covered at a copay of $10, and for 18 visits per year, we'll cover that. We do include a gym membership, so once you stay nice and healthy and strong, get to the gym membership, socialize a little bit. There's different classes, whether it's water aerobics or weightlifting classes, that you can actually join and no cost, and we'll pick up the tab on that gym membership. What we have here, Ken, is actually called the Health Products Benefit Catalog. As you see right here, there's a lot of things in here, such as diabetic supplies, different tablets, socks. There's a blood pressure monitor, there's a cane, even things that you would buy non-prescription over the counter, such as Halls, cough medicine, ibuprofens, anything like that that's in this book right here. We will actually pay up to 130 credits every quarter for you to use. Just call the 1-800 number here, order it, we'll pay for the product and the shipping and handling being sent to your house.
That's great.
So we want you to use that, and guess what? If you don't use it that quarter, it accumulates throughout the year. So you just need to use it by the end of the year, or else it goes away. So, between these 2 pages right here, honestly, Ken, this is all the benefits that you can receive from Medicare. Part A, B, C, D, all of those things that you hear on the news, this is everything from top to bottom, A to Z, all the benefits that you can receive right here through Medicare and through United Healthcare. One of the important things that we do here is we go through and we help individuals get enrolled onto this plan by filling out some basic paperwork. Do you have your red, white, and blue card?
I sure do.
Okay, perfect. Oh, is this it right here?
That's it.
Thank you. All right, so I got a couple quick questions I got to ask you real quick, and most of them are just basic information to help you get enrolled. Now, do you have any questions at all before we get started?
It sounds like a great plan, Marco.
Great. It's a quick, simple process. I just need to fill out some of your information. I'm going to follow all this information right here. Everything on your Medicare card is correct.
It's current, Marco.
All right, good. So I got all your information. I have your last name, your first name. I have your date of birth. Go ahead and put in your phone number, and this is the best number to get a hold of you at?
That's my contact number.
Good, good. Now I need your permanent address, and you gave it to me earlier right here on your ID. Do you have another address where you have your mail sent to?
It's sent to that address.
Send it all the addresses. Perfect. Great. Again, Medicare requires that I follow all this information, so I'm just going through and following the information off your Medicare card. Just fill this out real quick. A couple of things. Now, one of the things that I always get to right here is it says, how do you want to pay your premium? Again, were you listening? Did you catch how much I'm going to charge you every single month for this plan?
I thought it was nothing unless they had a copay, Marcos, but it didn't look like there were a lot of those.
Exactly, and I always do that because sometimes what happens is I usually don't fill out this information, or if I do, I say just send it to me by mail. But I actually like to communicate with my clients that, hey, there's zero copay, so I'm just making sure you're listening to me. There's no monthly plan premium for that. So this right here, don't worry about that. We're going to continue on because you have no monthly plan premium. A lot of times I don't fill this out, or when clients get this information, because you'll keep all of this information and you'll get a copy as well. And when you do that and you see, that question, I don't want you to forget, because we've talked about a lot of stuff. I don't want you to forget and call me and worry about how much you're going to pay for it, because there is no monthly plan premium.
So there's no cost at all for me for this thing?
Not at all, and unless you go over those amounts that we were talking about, that's what you're gonna pay for. But other than that, it's all covered 4% by Medicare and Medicaid and by the United Healthcare plan.
Great.
So a couple quick things is they're gonna ask, do you prefer the information sent to you in any other language outside of English?
English is fine for me.
Great. There's a couple quick questions here. I already know the answers, but I got to ask you them real quick. Do you have end-stage renal disease?
I don't, not currently.
Okay, that's kidney failure and everything like that. So a lot of individuals, they have it's a longer health process. So the insurance company just wants to make sure. One of the other questions is, do you have state Medicaid, which is right here on your card? I'm going to go ahead and take that and fill that out as well.
Okay.
Are you enrolled into the long-term care program?
What is that?
So long-term care is for individuals who have other serious health issues, conditions that need additional things that you're really never going to get over. It's a chronic condition. It's a chronic disease that requires additional help. Most of the time, it'll say it on your Medicaid card. It didn't look like you had it, so.
I don't think so.
Okay. And then, do you live in a nursing home or long-term care facility? Obviously, I'm meeting you here in your house, so that's not an issue. We don't have to worry about that.
Right.
A couple other quick questions. Again, I know the answers, but I just gotta ask them. Do you have any health insurance outside of Medicare and Access, Medicaid?
I don't.
Okay. Do you or your spouse work?
My wife works part-time, Marcos.
Okay, great. This question is actually geared, and I want to explain this, is it's geared to individuals a little bit more specific of, do you have health insurance that's going to be working along with the Medicare? Because Medicare is going to be primary insurance. I just want to let you know that if you do have insurance, this will be your primary insurance.
Okay.
So no need to worry about that. And again, here's another one is, do you have any other benefits such as TRICARE or VA benefits that are actually going to help out pay for those, offset those costs?
I don't.
Okay, so this will all be the one card. All you need to do is just take this one card, no matter where you go, the doctors, the hospitals, your prescriptions, the dentist, anything you need, we're going to help you out with that. Make it real simple for you.
What if my brother is a veteran, though? What does he do? Anything different?
You know what? If he qualifies for this plan, he can actually use both of them. That's a great question. So he may be interested in giving me a call, because he probably goes to the VA to get his prescriptions, which I suggest that most individuals do. But in case something happens to him outside of the VA and he goes to the emergency room down the street, that's where we're going to step in and help him cover the cost.
So this will work for him, or it would work for me anywhere else if I did that?
Absolutely,
Okay.
yep. As long as you kind of go through the network of doctors, you're able to see any doctors you need to. And if it's an emergency, don't worry. Just like I said, just go straight to the emergency room. We'll take care of you.
Right.
So one of the things here is we got to put down your information. Nothing's going to change, like I said, as long as you go through the United Healthcare Network. And one of the things it's going to ask you is your provider, your PCP name. Who's your doctor?
That's Dr. Stan Jones here in town.
Okay, Dr. Jones. So what I'm going to do is I'm going to go ahead and fill out this information, and we're going to, when you get your new card, it's going to have Dr. Jones's information on it as well. So as long as he accepts the plan, which we already did verify, then you're good to go. Okay, you can have all this. Now here's some important information right here. That honestly, this is all the information we already went. Just want to make sure that as long as you understand that there is no premium involved with this plan, but some individuals may have to pay a premium for Medicare. Some individuals actually may have other and late enrollment penalties. We went through all this information. It doesn't really apply to you. But in case you did have any questions, you could always ask me. at any time. That's why I left my business card for you. There are certain enrollment periods, but because you have both Medicare and Medicaid, we're able to do that. Your plan takes into effect the first of the following month.
Right.
Okay? So we're going to be able to get this to you literally this week. By the end of the week, next week, you'll be ready to go. So if you have any questions about using your dental benefits or anything, I work with a lot of providers here in a 10 to 15 mile radius near your residence. So just give me a call. That's what I'm here for, okay?
Great.
So like I said, everything right here is what we've talked about, is covered in the book. All I need right here is a signature from you and date. Today's date is the 25th, and that's all I need to do. This portion right here, you don't need to worry about it. You don't have a power of attorney, I'm assuming.
I don't.
Okay.
So just sign here, Marcos?
Yeah, just sign right there. That's perfectly fine. With the date as well, 25th. Perfect. Great. Now I'm going to go ahead and take this information with me. I'm going to fill out the rest of this information. This is going to say right here, as you can see, I'm going to put it down right now. Today's is the initial receipt date, so I'm going to go ahead and put today's date down and the proposed effective date. So these plans always go into effect the first of the following month. So because we're in September right now, it's going to go into effect the 1st of October. So I'm going to lay it right here. And you're going to get copies of this as well, so if you need to refer back to it, you can go ahead and always look back at it as well. I'm going to put my information here, my name, my phone number as well, and I'm going to sign it, and I'm going to actually send it in tonight. Per CMS regulations, I got about 24 hours to send this paperwork in, so it'll get in tonight, and there shouldn't be any reason why you are not accepted into the plan unless there's something funky going on with Medicare. But other than that, it'll be going through. You should receive additional information from the carrier. But I'm going to go ahead and take this information, and really honestly, if you have any questions or your brother has any questions or anything, there's all your cards right there. Please don't hesitate. Give me a phone call. Remember, this plan goes into effect the first of the following month, along with all your dental benefits, all your health products catalog information, and anything else that you have. You can always give me a call.